So we've decided to call this From Beginning to End. So we need a bit of a flavor of the beginning here in Rochester. I wasn't actually here at the very beginning. I can tell you about when that was. So I did a little fact-finding mission to find out from some of the my more senior colleagues that have been around. This is not meant to capture everybody's name that did anything, because it would take a whole lot longer than we really have tonight, but just to recognize a few people, and some of whom are in the audience tonight, of their contributions and their place in the response to the epidemic. I've heard it said that if you've got to have HIV, if you've got to have AIDS, Rochester may be one of the best places to have it. And I think between the university and the community collaboration we have, I think that's the case. And in the early days, in fact, a lot of the early patients were people coming back from really New York City to come to a home. Come home when they got ill and were managed here. So just a few slides. So I really wanted to start with in 1982, so this was just very shortly after the article in MMWR, and in fact even during 1980, did I say 72? 82. Even before that, of course, I believe there were some cases, even in potentially 81, that were seen locally here. The very first clinic was set up really by Dr. Roy Steibiegel, who attended our New York City event, wasn't able to make it this time. He was a faculty member of the infectious disease division at the U of R. And primarily with his, he was a senior ID fellow, Tom Rush, at the time. And this was, they started this even before the designation of AIDS was made. It was when it was called GRID, gay-related immunodeficiency, I guess. And what they did with Sue Cowell's help, and Sue has been everywhere since the start of the, and she's here somewhere too. There, hi. Set up a clinic in University Health Service here at the U of R to screen gay men for signs of immunodeficiency, drew blood, and subsequently, when the test came out a couple years later, identified that indeed, what they called then HTLV3/LAV, later become known as HIV, was the cause of a decent proportion of these young men who were ill. Dr. Betts, of course, has already been mentioned, and really anybody in the infectious disease division at that time kind of had a role in this kind of strange new illness that occurred. When Dr. Steibiegel moved to Stony Brook in 83, and by the way, Amneris, who has been back with us for a number of years now, was actually here predating me. She was a fellow that went with Dr. Steibiegel to Stony Brook. They were setting up a new ID division down there. Amneris was still a fellow, and I guess working on leishmaniasis, I understand, a parasitic disease that is seen in the tropics. Then the bulk of the care for a short period of time, for a year or two, was taken over by Ray Miewski and the ID physician at St. Mary's, Rich Magnuson, and Ray is here tonight, of course. And there wasn't any treatments to offer at the time. It was more taking care of people that were very ill in an inpatient setting and that sort of thing. Then Ray came back to Strong Memorial and brought the care back from there to Strong. And that's when I believe that Bill got very involved. He was a renowned hospital epidemiologist, and so he had a full-time job when this all started. And he was managed to kind of get out of that and into this field about that time. And he became pretty much synonymous with HIV here in Rochester. So during that time, it was called, the infectious disease clinic. There were yet no medicines to be able to use, but certainly patients were seen when they needed to be and hospitalized when they had to be as well, too. In 1986, then, Ray Dolan and Dick Reisman, they were really the people that led putting in the grants for the research, the ACTG, and what was called at the time the AIDS Vaccine Evaluation Unit. This is when these two NIH-supported clinical research networks were established, and they've been here in Rochester ever since. In fact, we're one of only two universities in the country that have had them since the beginning and continuously from the beginning, these two particular types of research clinics. Dick and Ray actually had come in 1982 and were somewhat involved. Certainly Ray was running the ID division, but really the breakthrough came when the networks were set up and finally the government helped support some research on the cause of AIDS. When I moved to town in 1987, I remember even before I started, I was watching the news, and the news was that Strong Memorial Hospital set up the first HIV clinic dedicated to taking care of patients with AIDS. I guess in retrospect, it wasn't exactly true, but media sometimes gets things a little bit off. But at any rate, that sounded good. And of course, that's when Bill moved in a big way to take care of the people at Strong. And people may remember Amy Portmore, Bill's sidekick, who worked very closely with him when I arrived. It was good to have a clinic then because at least there was AZT, something we could use, give to patients. And it, in fact, single drug AZT worked for a very short period of time. Unfortunately, and later, of course, we found that you needed a combination of medicines. So, about that time, Ray Dolan got in the ACTG, got the leadership of the phase 1 protocol for the second antiretroviral to come out, DDI. It wasn't published until about 1990, I believe. I think in '89, the drug was actually available by compassionate protocol, but at least we were testing the drug here in Rochester in 1988. Then you all know that Bill, and you may remember Steve Scheibel, he was a fellow in the ID division at our site, started what was called Community Health Network then on South Avenue. And coincidentally, Amneris snuck back into town. I didn't really notice it for a little while, but she was there. And then, of course, the other story of the different iterations of CHN over time and through ACHC and then Trillium and a couple of really nice clinics you've had too. So just to mention where I came into all this, I finally finished my fellowship in 1990, and when Bill left, I came into his position as director of the clinic. And I started a lot of my community outreach activities. I did want to mention the HIV in the Finger Lakes. The pamphlet actually just said that and not Finger Lakes region. And so when I was going out with Pat Corey Doniger to give her a series of 10 talks in all the little places in the catchment area of the Ryan White district, they would all say, "It's not really in the water, is it?" But so that's actually how I learned how to give a talk. I gave the same talk 10 times, and Pat and I went around and did this together, and we were going to, after the end of all this, write up, what we were going to write up was our experiences in the diners of all these small hospital diners and the quality of their pies. We never did write that up. We got too busy. Then in 1991, I moved over to the vaccine work, which I've been in ever since. Amy Portmore took over as the director of the clinic, and then finally Amneris, when Amy left in 1994, took over as director of the clinic and has been the ACTG principal investigator ever since. So I think that's about it, but I wanted to show this. Roy sent this to us. This was a very early AIDS benefit, May 1st, 1983. at Friars Inn, and some people may remember that. I don't myself. Does anybody remember that? Yeah. Okay, and $5, that's pretty good price for that, and wine and cheese, and although ours was free tonight, by the way. And they had music. We didn't have music tonight, but anyhow, and this was just something that Roy sent me I thought would be interesting to show you, in the Ramon Santiago picture along with it as well, too. So that's where I'm going to stop. We're going to go to the panel discussion next.